What's up everyone, I'm Jeremy Feldman, and on today's episode of Lively Charleston, we're going to be hanging out with Jeanette Blackwood of Charleston Harbor Veterinarians. Jeanette and her partner Krista opened in downtown Charleston in 2015, and their philosophy of creating a low-stress visit for both the pet and the owner has resulted in them carving out a niche in the pet care industry that's helped them build a client base that's been unbelievably loyal. All right, so with that being said, let's head inside and take a look. All right, Jeanette, thank you so much for having us. I'm really excited to get a tour of your clinic here and just kind of hang out with you and learn a little bit more about what it is y'all do.
Thanks for coming in. We're really excited, and today you get to be my veterinary assistant. Does that sound good to you?
It depends on what exactly I'm gonna have to do, but I'm ready to give it a shot.
Just help hold for an exam. We've got a great dog here and a wonderful little kitten.
All right, I'm ready, let's go.
This is our lobby. What you may notice is that it looks more like a home than traditional veterinary practices.
Yeah, it looks great.
We try to live by the idea of being more low stress. So a lot of veterinary clinics over the past several decades have been all about being medical and clean and sterile. And of course we are all of that, but they forgot about that you actually have a pet and a human coming in here.
Yeah.
And they get stressed in such situations. So I used to fill in at different clinics, and I found the ones that were in like in refurbished old homes, the dogs and cats were so much more relaxed.
It feels great. As soon as you walk in, it feels very comfortable, nice. I could see how people would feel relaxed here. This is a place I would come just hang out and like work on my laptop or read a book.
We love it when people come and hang out.
Done. Yeah.
So this is our cat only room, and it's specifically made to make our feline patients more comfortable when they come in. Instead of the stainless steel tables that you typically see, here we have a countertop. Okay. And so it kind of has a kind of like a kitchen feel. You know how many cats want to jump up on the counter at home?
Love jumping on the counter.
Yeah, they do. Yeah, good and bad. And so when the owners come in, they frequently come in through these doors. I'm not in here for several minutes. The technician, whoever's helping me that day, will be opening up the carrier, let the cat wander around the room, get acclimated.
Oh,
when I come in,
smart.
yeah. And so sometimes they're in here. You know how many cats like to drink out of the sink? So sometimes they're in the sink. Sometimes they're climbed up in the cat tree. Sometimes we find them hiding, and then we know those cats are a little bit more nervous, and we're going to handle them a little bit more, gently and compassionately. This is one of our dog exam rooms. We try to limit this one to puppies. You'll see later on when we go in to see our patient today, where you'll be helping me, you'll see a pretty much an identical image of the exam room, but we limit this one more towards our new pediatrics, our young puppies.
Ah, okay.
Yeah, so then that way they're not getting exposed to something that an older pet may have.
Yeah, so, I didn't know they were called pediatrics.
Sometimes, yeah, puppies and kittens, but we'll just mainly see our puppies here because we want to keep them free of like respiratory tract infections that can be contagious diarrheas, things like that. And it's close to the treatment area where we're glassed in, so like we can see them too, which is nice.
Can we go take a look at that?
Yeah, so in a lot of veterinary clinics, you hear that say, or technical teams say, we're going to take your pet to the back to draw blood or do the shots or something like that. And that's something for a client who is not familiar with your clinic, is something that can bring some anxiety to them. Plus sometimes pets don't like being separated from their owners. For that reason, we'll do a lot of our procedures in the exam rooms, but if it is something like a dental procedure or a surgical procedure, then that all goes into this portion of our hospital. But on purpose, we glass these in so that a client can stand over here and see everything that we're doing.
That's a really nice touch. From a pet parent's perspective, that has to be their worst fear, and you're performing surgery or doing some sort of operation on them, and they have no idea what's happening. Their mind probably automatically goes to the worst case scenario, and here the way you have it set up, they can just kind of watch and know that everything's okay.
They can, and we have some people who choose to come. Like we've had clients, we're doing a dental procedure, they're gonna sit here, and that's fine. I've been surprised by the number of people that have just been like really relaxed, and they're like, oh, I know what's back there. I'll go get a cup of coffee and I'll come back. So that's been wonderful too.
Where are we headed?
Right here. This is our dog room. We have a dog and a cat in here today. Oh, there goes Lou.
Got him.
Got him.
So what do we do? We're just gonna...
Yeah, who do you want to start with? You want to start with? Yeah, so a lot of clinics will actually put the dogs up on the table again. That's a stressful situation, so we tend to do a lot of them on the floor.
So you literally just kind of come hang out with them on the floor?
I do, yeah, we do here, yep. So that's one of the reasons why I CrossFit, is so I can get up and down off the floor all the time.
Yeah.
We do a lot of treats here, so that's what's going to keep him still.
Okay. So is this just kind of your standard periodic, quarterly or annual exam?
Annual, yeah, we
that
do
you give your
annual,
dogs?
yeah.
Okay. And what are you generally looking for? What are you
So
generally checking?
listening to heart and lungs,
Okay.
we assess for any sort of dental disease, which is why I was looking in his mouth.
Okay.
I'm gonna have you hold him stiller
Good
for me to look in
boy.
his ears.
Good
We
boy.
feel the belly to see if there's anything weird, like sometimes we find out they've been eating rocks, we can feel them in there
Really?
or something, yeah, or
Oh, wow.
we feel for tumors, and then we
Alright.
feel back here for their muscle mass and make sure their joints are good. And then we're gonna have you, this is like a classic tech hug. So one arm goes underneath the head like this.
Yep.
Against your shoulder, and then one underneath to keep him standing. That way I can look in his ears, because what I don't want him to do is to bounce his head around on the otoscope.
All right, so he's good to go. Clean bill of health. Okay, so we have one more.
We do. Kitties are a little harder.
Okay.
This is Lou.
Time to Lou.
So with him, we'll use the fold-out table that we have here.
Okay.
And the nice thing about it is, like, you know, when we were looking at River, we weren't banging our head on the wall or, you know, on the table.
Yeah. Oh, that's cool. Look how neat that is.
So cats, even just the process of coming to the vet can be very stressful for them. So we try to talk to owners, always leaving the carrier out, because we have so many cats that run and hide when the carrier shows up. So they get stuffed into a carrier, and then they get put in the car, and then they have this drive through traffic, they're car sick, they come in here. So we try to do the opposite. We try to tell you to leave your carrier on out for us, and then we bring him on in, and we try to give him treats and get him a chance to relax, try to give him some treats and acclimate him, and then start
That's great.
touching him, yeah.
And that's kind of in line with your whole, your whole philosophy here is about creating a stress-free or reducing the stress and
Right,
anxiety for
yeah.
owners and for the pets.
That's exactly right.
Okay.
And we try.
I love it. I love it. Okay, so what are we going to do here with Lou?
So same thing. I'm going to start. Actually, he's eating so much. I'm going to start by listening to his heart. Let's have to remove some clothing.
Sorry about that.
Take Lou's shirt off.
Yeah, that's what we usually do.
There you go. And so the cat's heart, you can always hear the best right at the sternum. Do you want to listen?
Yeah,
Which is right there in the center.
Oh, yeah.
And that's actually pretty low for cats. So lots of cats, when they come into the vet clinic, although it's considered tachycardia or really high heart rate, will get like a 180 or a 200. But the more relaxed they are, so this is much less than that, maybe
Yeah,
like
really?
140
Okay.
or something. Yeah, that means he's happier, like we're listening to him in his house. All right, go feel your belly. I know no cat loves this.
Same thing, just kind of checking for lumps or
Mhm,
something
same thing,
abnormal in
yeah.
there.
And cats, you can feel a lot more. You can, dog, you can too feel the bladder and the colon, but we. Oh, now you might have to just kind of gently, just
Right here?
Yeah, so we can check his mouth. Kind of, Jeremy. Good. Good. Thank you for letting me look. He looks perfect as always.
Great.
Awesome. Jeanette, thank you so much for hosting us, for letting us come hang out. Thanks for making me your assistant. I had a blast working with the animals back there. I really appreciate it.
Oh, thanks for coming out. You did a great job. I'm proud of you.
Awesome. Are you going to be hiring part-time anytime soon?
You can submit a resume.
We'll see. We'll take it from there. Okay, so if anybody watching the video wants to find out some more information about you or about the clinic, how can they find you? How can they learn more about you?
You can just, well, first off, you can just Google Charleston Harbor Veterinarians. We're at 280 Rutledge Avenue, and our website is charlestonharborveterinarians.com.
Okay.
Phone number 843-410-8290.
Flashing on the screen, right? All right, so there you have it. Check them out, Charleston Harbor Veterinarians. Jeanette, thank you again. That's all we have for this episode. You guys have an amazing day. See ya. All right, that's all we've got for today's video. I hope you enjoyed it. If you did, make sure to give us a thumbs up and subscribe to the channel. Also, if you want to be notified every time we release a new video, click that little bell icon. Hope you guys have an awesome day.